Jeannie. Thank you, Jeannie, for letting us share your video today, teaching for our doctors and students and patients. How is Jeannie feeling?
I'm feeling good.
Very good. I feel pretty good too. I'm going to do some marking. We're treating the upper eyelids, and you can see her pictures. Why don't you show them their pictures there? So upper eyelid, traditional eyelid procedure. Take skin, muscle, fat from everyone, but I take the skin only. You leave the muscle, you leave the fat, because as we age, we know we're going to hollow, so you want to preserve as much tissue as possible. So you're going to feel my hand here, Jeannie. So what we do is I outline the upper eyelid crease. And once I mark that, I'll use my ruler just as a general landmark from the last lateral eyelash, and in an oblique fashion I measure up how high I go. So there I'm at about 12-13 millimeters. That's just her anatomy based on lash proportion. And then I'm also using my judgment about how far laterally we want to go in relation to the lateral aspect of the tail of the brow. Same thing on the other side for consistency. And once I've marked out the lower eyelid, or it's the lower portion of the eyelid incision, then I pinch, and I'm just grasping how much skin I can take that her eye still comfortably closes. So as we say, just enough but not too much. And so Jeannie can feel me pinching. I'm going to put a little bit of the numbing medicine. Jeannie, how long have you been thinking about having something done for?
Again?
How long were you thinking about having your eyes done?
Like 6 months ago.
So what inspired you to say, okay, I'm going to have my eyes done? What was it that prompted you?
I feel when people see me and when I see in the mirror, I feel like tired. I can't use the makeup because nobody can see it. Really, I don't like when I'm seeing in my, in the mirror. I don't like it.
Well, you've come to the right place. Now, how did you find us originally? Who referred you to us?
I think I saw you on Facebook.
Okay.
Yes.
Very good. Now you feel a pinch here, numbing medicine. Pinch on 3, 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad there?
Not so bad.
So it's a little numbing. We go slowly. This is subcutaneous for my physicians and students that are watching.
Okay.
Was it helpful to see our videos on Facebook?
Yeah.
If you've seen our videos, you know a lot about us. Did you watch the fillers or eyelid treatment or facelift, or what kind of videos did you watch?
All of them.
All of them, okay. People tell us when they watch the procedure videos, it's easier to have the procedure than it is to watch the video. The video is sometimes hard to watch, but I'm glad that was helpful to you. Now, for those of you who are watching, you know we're on a mission to stop bad plastic surgery. We're here to show people how to do things the right way, so if you have a family member or friend that's interested in a treatment, please share with them, and that way they can see the right way to do things, and it can all be done under local anesthesia. People today, they don't need traditional facelifts, they don't need traditional eyelid procedures. You can do things differently, local anesthesia, safer, better for you, better results. And I like to talk about my ABCs of plastic surgery, because people always want to know. They say, well, what's the best treatment for me? When you know the ABCs, you will make your best decisions because you understand the bigger picture. So the ABCs of plastic surgery, A stands for area. There are 4 areas we address to improve the facial appearance. You feel pinched on 3, 1, 2, 3, pinch. If we sag, we tighten, and that's what we're going to be doing today, is tightening the eyelid skin. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin, we can polish and repair the skin. The 4th area is better than everything else, and that's our behavior. And nothing looks as good as Mother Nature's free facelift when we smile. The smile always looks the best. I can't outdo that. Jeannie, how are you feeling, dear? You doing okay?
Yes.
That's A for area. B stands for boundary. What are the rules for good cosmetic treatment? Safety is always first. You must look natural. Let's prevent future aging, and then let's get as much improvement as possible. We can't make things perfect. We're not God. We do the best we can. If we need to come back another day and do more, it's better than going too far. So A for area, B for boundary. I'm just putting in the lidocaine for those of you just joining us. And for the physicians and students that are watching, this is subcutaneous. How are you doing, Jeannie?
Good. I feel the area cold.
Yeah, it'll feel cold or swollen, and it'll feel a little difficult to open the eye. Now, C, ABC of plastic surgery, C stands for combination. If we want our best results, we combine. And we did do a little bit of the Botox, Dysport, Xeomin for Jeannie here. So combination always gets the best result. If we want our best result, but we just want to do one treatment, then we talk about tightening. And if we want our best result with no downtime, we talk about fillers. Fillers do a great job, but they don't give us a lift, same as tightening. Lifting, we get wonderful results, but I can do even better when I combine. So now I'm just making the superior incision here, and Jeannie will feel pressure, but she doesn't know what I'm doing. She can't tell, because thank goodness for lidocaine. Everything's looking good. How are you feeling, Jeannie?
Good.
Once I make that skin incision, then I'm going to take my tenotomies and we trim that. Now this is a subcutaneous dissection plane. We're right above the orbicularis oculi, that's the muscle. So you're preserving the muscle, preserving the volume, and that means less invasive, less recovery. Everything's looking good. Thank you for watching and thank you for joining and sharing. If you are looking to do a cosmetic treatment, we are on a mission to stop bad plastic surgery. Please share this video with family or friends. They're going to be upset if you told them, hey, I was watching a live eyelid treatment, and they're going to say, well, why didn't you share it with me? Why didn't you let me know? So they can ask questions too, and if you see any questions, Justine, please share. So this is, you can see here on the tray. Can you show them on the tray? Or else I'll bring it over, right? So this is the eyelid skin here, right? Okay. And then we blot. And I'll do a little bipolar cautery. Just a little touching, a little painting. Jeannie, do you feel any pain at all?
No.
Me neither. Everything's looking good. Just painting with the cautery. And I'm going to trim just a little bit of the skin that I see there, just a tiny bit. I like to fuss over the little details. And Yesenia has everything set up perfectly for me. Thank you, Yesenia. And we have such a great team here. I feel a lot of love in the office every day. My team will take great care of you as well. So, ABC's combination treatment. D. The D of ABC stands for different perspective. We never see ourselves the same way that others do, which is really interesting because when we look at other people, we look at them socially. But when we look at ourselves in the mirror, we do not look socially. We look seriously and we look for imperfection. So now I'm doing 5-0 proline. And that's the reason people go too far if we're too hard on ourselves. That's why it's important to have a good doctor to protect you. I will not let that happen here. But it happens all the time. That's why it's so important to have a good consultation, good discussion, good expectations to get a good outcome. It's not rocket science. It's very easy to make sure you look natural.
I'm taking the stitches now.
I'm just putting a little stitch across through here. Everything's looking good. Thank you for watching. Thank you for sharing. We have our seminar coming up. I think it's on Wednesday or Thursday. I'm not sure which day. But I'll be there whatever day it is. Go to imagelift.com/events. And register while you can. We have our specials for a limited time. There's $1,000 off facelifting, so take advantage of that. And download our Wall Street Journal best-selling book, The Smile Prescription. And we guarantee we can make you look younger. Everything's looking good. So you see this one stitch. When I did my training, we would do a number of stitches all the way across. You'd have to take out each one of those. This is just one continuous stitch all the way, and it doesn't leave any outside suture marks. So, far superior way to go.
So how many normally it's?
I leave the stitches for 1 or 2 weeks. At the first week, if they're ready to come out, we take them out, but if they're not, we take them out the second week. And then you just trim the knot and just slide that stitch all the way out.
Oh, how many stitches?
One continuous stitch all the way across. You can see it here. Just pull it right through. Very good. You're going to love it. Looks natural, not overdone. Perfect. Jeannie, how you feeling, dear?
Good.
So you see things close very nicely, and now I just put a little knot here. And double that knot. Same thing on this side. And then we trim, and we're done on this side. Now, Jeannie, can you open up your eyes for me, please?
Both?
Yep. How many fingers here? It's going to feel hard to open up this side because it's full and swollen. So I'm going to come on that side. You stay right where we are. That's fine if you stay there. I'm going to come from the outside. Come.
You got it.
Yeah. Thank you. And now I'm just going to test with a little bit more numbing medicine. You feel pinching there or not really?
No.
Put a little bit more numbing just for good measure. Just enough, but not too much. So I am a double board certified facial, plastic, and reconstructive surgeon. We're in Tampa and the Villages, Florida. Give us a call for a consultation. This way you'll know what is right for you. People want to know the pricing. It really doesn't make sense to give you a price if you don't have a consult because you don't know what you're a candidate for. And we need to make sure you have the right expectations. What is your recovery or downtime? We have no downtime options. So those are all the things that go into us making a decision and saying, okay, well, here's how much it costs. So this is my 15. Everything's looking good. Perfect. And same thing, I grab the skin, elevate, traction, counter traction, and I can feel the fibrous connections between the skin and the underlying muscle. You might feel a little burning, and that's going to go away. That's the numbing medicine. So you feel a little burning from the numbing medicine. It goes away very quickly because the lidocaine numbs. And there's a little bit of that numbing medicine under the skin here. So we'll just sop up that area. How about now? Are you feeling any pain? Okay, good. Everything's looking good. Perfect. So you can see from both sides, right? Taking the eyelid skin. This one's on this side, this one's on that side. And little bipolar. Thank you for watching. Thank you for sharing. We're in Tampa and the Villages, Florida. I'm going to trim just a tiny bit here. Perfect. So with bipolar, uses electrical current. You don't need a grounding pad for this. Just a little painting cautery. You don't want to over cauterize. You feel a little pinch there? Are you feeling any pain at all, Jeannie?
No.
Everything's looking good. So recovery time.
The smell.
You smells goofy, yeah. It doesn't. You smell a little. It smells like burning hair. The recovery time. There's physical versus social downtime. No physical downtime with the eyelids. You can really get back into your routine. Now, don't go too vigorous or strenuous because you don't want to break a stitch or anything. It's very hard to do that, but we need to listen to our body. Socially, you pass the grocery store test after the eyelids about 4 to 7 days. You walk into the grocery, nobody does a double take. So this is a running subcuticular suture into the dermis. And as you can see, we keep things very simple, very straightforward. Don't need to remove the fatty pocket. Don't need to take out muscle. Give us a call, download our book, learn the pricing, learn what's right for you. Most of our patients, they have many, many active years ahead of them. People are living a lot longer. People are looking a lot better. A lot of my patients, they aspire to live 100 years or more. And whatever your age is, some people say, I don't want to live that long. But however long you want to live, we want to look and feel our best. And there's never been a better time to do a treatment because the technology is so much better. The results are better. It's safer. We have the ability to get results that 30, 40 years ago, they just they weren't able to do that. You doing okay, Jeannie? You feel a little burning in the eye, so what I'm going to do is I'll blot, and that's going to go away. So we're finishing now, and when the lidocaine seeps out, sometimes you feel a little bit of that burning, and that's going to go away. How about now? You feel anything, Jeannie?
No.
Very good. Perfect. Thank you for watching. Thank you for sharing. Last few stitches. If you're just now joining, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're in Tampa and the Villages. We have our seminar coming up this week. We'd love to share with you what can be done. We are on a mission to stop bad plastic surgery and help people raise their standards when it comes to cosmetic treatments. Very good. Tie a little knot here. And one over here. Now, Jeannie, are you going to watch your own video?
Yes.
You can share it with your friends and says, I did it. I got my eyes done. So we trim this one here. So in 1 week, we're going to see Jeannie back. If she needs me before then, she lets me know. Her job is to stay shiny because when moist wounds heal the best, and she'll have ice. But ice sometimes, she's going to have swelling. You can ice, you can hold pressure. Open your eyes for me. How many fingers here?
2.
How about over here?
3.
Okay, you did great. Congratulations to Jeannie. Yay, hooray. Thank you for your comments and your shares. Let's take a look at her pictures from before. Let me see. One or two is fine.
I gave her already.
Okay, that's fine. Yeah, that's fine.
I
Thank
have
you.
sculpture.
Great job. I'm ready.
And I'm ready to.
Thank you all for watching. Thank you for sharing. Dr. Rich Castellano here today with Jeannie. So proud of you, Jeannie. You look great. You did very well. Thank you for being a great patient. We didn't have to give her any warnings or anything like that. I'm just kidding. We don't give warnings. She did great, and we'll see you in the next video. Thank you all for watching. Great job. Looks really, really good.